Good afternoon, Hanson Jones. My name is Mihiraa. Let's start the warm-up session. Describe your ability to handle high-pressure situations.
I excel under pressure and thrive in fast-paced environments. At the urgent care clinic, I have handled numerous patient crises, demonstrating my ability to remain calm and effective. One particular incident involved a young child who became unresponsive during intake. I quickly assessed the situation, checked vital signs, initiated CPR, and coordinated with a colleague to summon the doctor. The child was revived, and my prompt actions were crucial in the outcome, highlighting my capability to manage high-stress situations effectively.
Discuss your personal attributes that make you especially qualified as a nurse.
My attention to detail is exceptional, ensuring accuracy in charting, medication administration, and patient assessments. I prioritize efficiency without compromising precision, always double-checking my work. Additionally, I am highly observant, often noticing subtle patient symptoms that others might miss. This keen observation helps in providing thorough and precise care, which is vital in nursing.
Have you ever had to deal with a distraught family member? How did you handle the situation?
Dealing with distraught family members requires empathy and clear communication. In urgent situations at the clinic, I have encountered several anxious family members. I always speak calmly and honestly, explaining the patient's condition and the steps we are taking to ensure the best care. This approach not only comforts the family, but also builds trust in our medical team's abilities.
Tell me about a time when you had a conflict with a supervisor. How did you handle it?
In a previous role, I suggested improvements to an outdated patient check-in method. Despite my supervisor's disagreement and decision not to implement my suggestions, I maintained professionalism. I continued using the existing process without further contention, understanding that workplace harmony was more important than pursuing a procedural change.
What personal characteristics should a staff nurse possess to be good at the job?
A staff nurse must be organized, efficient, and possess a good memory to perform duties accurately and on time. Sensitivity and a pleasant demeanor are also crucial, as they help in providing compassionate care. It's essential for nurses to go beyond just administering treatment, aiming to make patients as comfortable as possible through empathy and understanding.
Your preparation time is over. You can now start your roleplay.
Hi, Mihiraa. I can see you're looking a little concerned. Please know it's completely normal to feel this way after giving birth, especially with your first baby. How are you feeling right now, both physically and emotionally, after everything that's happened?
Oh, Nurse Jones, thank you for saying that. I am just so overwhelmed. Physically, I'm quite sore and exhausted. Emotionally, I'm happy, of course, but also incredibly anxious. I look at my baby and feel like I don't know anything about caring for him. What if I do something wrong? I'm worried about everything, feeding, knowing if he's okay, even just holding him.
It's perfectly understandable to feel that mix of emotions, Mihiraa. Many first-time mothers share those exact feelings, and that's why I'm here. We're going to spend some time together now going over some essential newborn care, and I want you to feel more confident by the time we finish. We'll start with feeding and some important safety tips.
Okay, feeding is a big one. I want to breastfeed, but I'm not sure if I'm doing it right. It feels awkward, and sometimes he just doesn't seem to latch well.
It's completely understandable to feel a bit unsure about breastfeeding, Mihiraa. It's a new skill for both you and your baby, and many mothers feel the same way. Let's go through some tips that often help. When you're ready to breastfeed, the most important thing is to make sure your baby's head and body are well supported and in a straight line, almost like their ear, shoulder, and hip are aligned. This helps them swallow comfortably and effectively. Then, when your baby opens their mouth wide, guide them to your breast, ensuring their mouth covers not just your nipple, but also a good portion of the areola, which is the darker area around your nipple. This helps them get a deeper, more effective latch, stimulating milk flow and preventing soreness for you. Now, after a good feeding, babies often swallow some air, which can make them uncomfortable. That's where burping comes in. A gentle and effective way to help them release that excess wind is to seat your baby on your lap and gently tilt them forward. With one hand, you'll want to support their chin and jaw, making sure there's no pressure on their throat. Then, with your other hand, you can gently rub or pat their back in a consistent rhythm until you hear that little burp. It might take a minute or two, so be patient. We can practice this together whenever you feel ready, and you'll get the hang of it quickly.
Thank you, that sounds helpful. I also noticed some odd things about his skin, and he sleeps so much. Is that normal? And I feel so tired myself, and I haven't lost any weight yet, even after giving birth.
Those are all very valid observations, Mihiraa. Let's talk about the changes you might experience after birth and what's normal for newborns. Firstly, the tiredness you're feeling is completely normal. Your body has just done an incredible amount of work, and healing takes a lot of energy. You might also notice only a slight weight loss in the first week as your body adjusts, and that's perfectly fine. For your baby, yes, they do have frequent feeding needs. Newborns often feed every 2 to 3 hours because their stomachs are so small. As for his appearance, skin variations are very common in newborns, whether it's a bit of jaundice, birthmarks, or even peeling skin. These usually resolve. Their breathing can often seem irregular, sometimes fast, sometimes slow, which is also typical as their respiratory system matures. And that jitteriness you might see, especially when they're startled, is usually just their developing nervous system reacting. It's important to remember these are all normal parts of being a newborn.
It's a lot to take in. I just want him to feel loved and safe, but sometimes I feel too tired to even properly connect.
That's a beautiful thought, Mihiraa, and that connection is so important for both of you. We really encourage bonding through things like skin-to-skin contact, just holding him close to your bare chest. This helps regulate his temperature, breathing, and heart rate, and it's wonderful for emotional connection. Also, try to respond to his cues. When he stirs, cries, or roots, it's his way of communicating, and responding to him builds trust and security. It's also vital to acknowledge that it's okay if you feel overwhelmed sometimes, and it's perfectly fine to seek help. Do you have any family or friends who can offer support?
My mother is here and my husband is trying his best, but I still feel like I have so many questions and I worry about when I go home.
It's great that you have support around you. Please know that our care for you and your baby doesn't end when you leave the hospital. We have excellent follow-up care available to ensure you continue to feel supported. This includes lactation support from our specialists if you have more breastfeeding questions and guidance on your baby's vaccination schedule. You'll receive an immunization card to keep track. We also have a 24/7 helpline you can call anytime you have a question or concern after you go home. Do you have any other questions right now? Or are there any particular concerns that are still weighing on your mind?
I think that covers a lot for now. The helpline is reassuring. Thank you, Nurse Jones. I feel a little bit calmer.
You're very welcome, Mihiraa. Remember, you're doing a wonderful job, and we're here to help you every step of the way. Don't hesitate to call on us while you're here and use those support lines once you're home. Take things one day at a time and enjoy these precious moments with your baby.